Hello, this is Dr. Rhonda Johnson. Today is Wednesday, February 22nd, 2023. And today I'm talking about prostate cancer risk. I've spent a lot of time this month talking about risk for cancer because, during the pandemic, many people put off seeing their doctor. They put off having screening tests. So we've talked about tobacco, smoking. I've talked about cervical cancer. And today I'm talking about prostate cancer because it occurred to me I've never talked about prostate cancer, and it's very common. Now, first of all, a little bit of anatomy. The prostate gland is only found in men. Women do not have this. What is it? It's a male sexual organ. Its function is to provide fluids to carry the sperm. Now, the male urethra runs right through the middle of the prostate gland. Now, prostate cancer is an abnormal growth of cells in the prostate gland, and it can spread to the surrounding tissues, organs, and bones. Now, how common is it? I said it's common. 1 in 6 men will be diagnosed with prostate cancer in their lifetime. Fortunately, 85% of prostate cancers are diagnosed before they spread, making it a very curable form of cancer, and it does not have to be a death sentence. So what are the risk factors? Number 1 is age. Men who are 40 to 50 and up have a higher risk of getting prostate cancer. Next is family history. Your risk is very much higher if your father, your brother, your uncles have a history of prostate cancer. And then if you're an African American man, for reasons that aren't known, there's a huge disparity in prostate cancer. Black men are 1.7 times more likely to get prostate cancer and twice as likely to die from it as white men. Now, what are the symptoms? In the early phases, men don't have any symptoms most of the time. But when they do have symptoms, it's because of prostate gland enlargement. That's trouble urinating, a weaker urine flow, more frequent urination, especially at night. Men can have blood in the urine or their semen, painful ejaculation, or pain in the joints or bones. So how is it diagnosed? Well, most men know this through a digital rectal exam and a blood test called a PSA, prostate-specific antigen. Now, an elevated PSA, which is the blood test, may not always mean you have prostate cancer. Doctors like to follow that over time to see how fast it rises. Now, some men need additional tests, including a prostate MRI, which is an X-ray, or even a biopsy. But I cannot emphasize the importance of screening and early detection. Now, I'm not going to go into treatment because that's beyond the scope, but I'll just say treatment needs to be individualized. And what about prevention? No specific diet can prevent or eradicate prostate cancer, but there is strong and consistent evidence that says staying at a healthy weight lowers your risk, eating food that's, the rainbow for fruits and vegetables. Folks, it can be frozen fruit, frozen vegetables, high fiber foods such as beans, and regular physical activity and exercise. That has a positive impact on reducing the risk of many cancers. Now, the biological link between smoking and prostate cancer is not clear, as well as alcohol consumption. But listen, folks, smoking is never good for you and is linked to causation of other cancers. And there's some evidence that heavy drinking may speed up the risk of developing more aggressive prostate cancer. Now, most prostate cancer and prostate disease is managed by a urologist, a physician with special training in the prostate health. Just like women see an OBGYN for their special organ needs, I think men should have a relationship with a urologist. Doesn't hurt, folks. When you get 40 or 50, make an appointment. Men, make an appointment to see a urologist and let them tell you how often you should be followed. Now, I know that is not a evidence-based recommendation, but particularly if you're a black man, you have a positive family history, it doesn't hurt to get that relationship with a urologist. That's my message today. I hope it's helpful. Please share this message. If you have a father, a brother, an uncle, a grandfather, someone who's 40 to 50 up, or you have prostate cancer in your family, please share this message broadly, widely. So we know men don't like to go to the doctor, so help them out, ladies. That's my message today. Be safe, be well, take care.